Welcome back to this session, and remember we are still dealing with pharmacokinetics, and specifically we are still doing with absorption, and under absorption we want to talk about the mechanisms of drug transport. Remember we said for any drug to have its therapeutic effect, it has to go to the bloodstream. That is indeed it, if it is supposed to go systemic. For this drug to be able to reach the systemic circulation or the blood system, it has to pass across what we refer to as cell membranes, especially for a drug that is given orally. So how does that drug move across the cell membrane inside the cell and then eventually into the blood system? Now, those are the mechanisms of drug transport that we want to talk about. Now, under mechanisms of drug transport, they are basically divided into two. We have what we call the passive transport mechanisms, and then we also have what we call the special transport mechanisms. And of course, under the passive, you know very well what the word passive means. It basically means that there is no use of energy, and so the drug freely moves. However, there are some determinants, or there are some things that should be able to determine the movement of this drug, and one of them, and most important, especially with two of these passive transport mechanisms, is what we refer to as the concentration gradient. Now, under passive transport, we have three mechanisms. We have what we refer to as passive diffusion. We have what we call facilitated diffusion. And then lastly, within passive transport, we have what we refer to as filtration. Now, under special transport mechanisms, we have what we call active transport, and we also have what we call pinocytosis, as we are going to explain them in detail. Now, what is passive diffusion? Diffusion, in simple terms, is actually a simple diffusion, and here it basically means movement of this drug from a region where it is highly concentrated to a region where it is in low concentration. So across what we refer to as a concentration gradient. Now, once that concentration gradient is not there, then you will no longer have this passive diffusion. Now, so that is in a nutshell what we mean by passive diffusion. To repeat, basically you have a drug highly concentrated somewhere, and then it has to move to somewhere where it is less concentrated. So you see very well that there we have a concentration gradient. In other words, you have that force that is trying to push it or to make it move from where it is highly concentrated to where it is less, to where it is less. And that is it's a simple kind of diffusion. But it is also very important to note that lipid solubility is one very important factor of determining this movement of this drug. If the drug is highly lipid soluble, then it can easily cross the cell membrane, as we said earlier on. The other factor is the concentration gradient. If there is a steep concentration gradient, or if the concentration gradient is maintained, then the drug will keep on moving from where it is highly concentrated to where it is low. However, if we have maybe equal amounts of the drug outside and inside, and then the concentration gradient is no longer there, then you'll have this drug stop moving. Then the other factor that is very important is the degree of ionization of this drug. If this drug in solution appears mostly in its non-ionized form, then it will easily diffuse. Why? Because we said for all the drugs to be absorbed, they have to be in their non-ionized form or state. And so if this drug does not easily ionize, or if most of the time this drug is in its non-ionized state, then this drug will easily diffuse by simple diffusion, or what we refer to as passive diffusion. Now, we have what we also refer to as facilitated diffusion. Now, just like the word facilitated, there should be something that is aiding movement of this drug from outside to the inside, or from where it is highly concentrated to where it is less. And these are basically carrier proteins, what we call carrier-mediated transport. Now, they do not require any energy. However, they utilize the properties of a simple diffusion to make sure that they move drugs across. They do not require any form of energy. That's why we refer to it as facilitated diffusion. Of course, they are also subjected to a concentration gradient, and for that matter, saturation. In other words, if we have more drugs inside, then we say that that carrier protein or that carrier transporter is actually saturated. Yeah? So that is what we refer to as facilitated diffusion. Now, the other third one under passive transport is what we refer to as filtration. Now, you know what filtration means. Filtration basically means movement of a drug with reference to the size of the drug particles, but also some pressure, like for example hydrostatic pressure. I'll give you a very common example. You have a sieve, and then in this common sieve that we use, and then you're pouring water or a solvent that has some constituents in it. You will realize that within that sieve, the solvent will easily pass through, and probably those smaller crystallized particles will be able to go through the sieve. Now, what is aiding this? One is the size of these constituents that have to go through this sieve, but also some form of what we call the hydrostatic pressure, that pressure that pushes the constituent down via the sieve. The other common example is, during urine formation. One of the processes of urine formation is actually filtration at the Bowman's capsule. So the factors there that determine filtration are things like the size of whatever has to go through, but also what we refer to as the hydrostatic pressure. Now, those are what we refer to as the passive transport mechanisms. Now, we have what we refer to as the special transport mechanisms. And then the special transport mechanisms here, we mean what we refer to as active transport. The word active transport means that there is some form of transport that is involving energy. And for that matter, it might not necessarily, the concentration gradient might not necessarily be a factor, because we are using energy to transport these drug molecules irrespective of the drug concentration. So that basically means that we can even move against the concentration gradient, because why? We are using energy. Now, these, as I said, they expend energy. Like, for example, there is a pump which we refer to as a sodium ATPase pump and the sodium-potassium adipase pump. That's a very common example of a pump that utilizes energy to transport potassium and sodium across the cell membrane. Yeah? So in other words, there is some use of energy. And in this particular context, the energy we are talking about is what we refer to as the ATP. And then, yes, they come to a saturation. Yeah? Even if it is active transport, there is what we refer to as a saturation limit. Yeah? So you cannot have it all. Yeah? It eventually levels off. Yeah? This is what we mean. It is also subjected to saturation. Yeah? So in other words, as if this is time versus maybe the concentration of whatever is being transported, yeah. As you increase the concentration, as the time goes on, the concentration increases, but a time comes when it levels off. Yeah. Now at this particular point, this is what we refer to as the saturation. Yeah. Now this is common with facilitated diffusion, but also the active transport. Now, they are also subjected to what we call competitive mechanisms, as we shall see in pharmacodynamics ahead. Now, the other special transport mechanism is what we refer to as pinocytosis. Here, basically particles that are suspended in the extracellular fluid are brought into the cell through what we refer to as invagination of the cell membrane. Now, this is what we mean. This is what we mean. If you have your drug here, maybe you have your drug molecule here, yeah? And then you have your cell. And then you have your cell here. You have your cell here. So what this cell does, as far as pinocytosis is concerned, is that it invaginates, it basically transforms itself to make sure that it brings this cell membrane, something like, maybe I should first draw something like that, yeah? So it makes sure that it transforms to bring this drug inside, eventually bring this drug inside by invaginating. So it eventually closes it up, yeah? So it eventually closes it up, and then you have, you have the drug coming inside the cell by a process called, or referred to as, pinocytosis. Pinocytosis. So those are what we refer to as this drug transport mechanism. So in a nutshell, we have talked about two forms of transport mechanisms. We've talked about the passive, and under that, we've talked about what we refer to as the passive diffusion. We've talked about the facilitated diffusion, and then filtration. Then under the special transport mechanisms, we talked about the active transport, which uses some form of energy. And movement of the drug is actually against the concentration gradient. And then lastly, under the special transport mechanisms, we talked about pinocytosis, whereby we said that the cell modifies itself to bring or to capture in the drug so that it comes within its, within its cell membrane inside the cell. Thank you very much. When we come back, we shall talk about the determinants of release of the drug from a pharmaceutical preparation.